so we're good there. So I'm going to start by doing a lung and chest exam. So I'm going to start by listening to your lungs. I'm going to start with your back. Do you mind if I undo your gown?
Yes, please.
Yes, please. So nice of you. Alrighty, so each time I move my stethoscope, just take a deep breath in, okay? Good, your lungs sound nice and clear. Next, I'm going to have you just drape your chest. I'm going to listen in the front. You can put your shoulders back. Same thing each time I place my stethoscope. I'm just going to have you take a deep breath, okay? All right, next I'm going to just have you like kind of roll up your sports bra and yep, just hold it like that. Perfect. Two more. Awesome, everything sounds great. Alrighty, if you want you can go ahead and slip your gown back on. Next, I'm going to have you lay back at our nice 30-degree angle. If you want, you can scoot up. Do you want the blanket on? I know it's kind of hot, but up to you.
Yes, please.
Okay, perfect.
I'm gonna
Yeah, go ahead and scoot up if you'd like. Whatever makes you feel. Next, we're going to move on to the cardiac exam. So I'm going to have you undrape yourself, please. Perfect. Okay, so first I'm going to inspect your pericardium, looking for any aortic impulses, lifts or heaves. And then I'm going to check for thrills, which is essentially just abnormal vibrations. So I'm just going to feel the lateral border of your heart, the base of your heart, and the apex. And I don't feel anything. Next, I'm going to go ahead and measure your apical diameter, so how far it is. So I'm just going to go under your sports bra here a little bit, right in your 5th intercostal space. Starts about there. So I'd say about that. I'm just going to go ahead and measure it with my nice Smokey the Bear ruler. It's about 2 centimeters, so that's in normal range. And then I'm going to go and feel for that point of maximal impulse again, right there. And I'm just going to measure it to your mid-sternal line. And you're at about 10 centimeters, which is also normal. Alrighty, moving on to listening to your heart. You can go ahead and relax, but I'm going to listen with both the diameter and the bell, so it's going to be a lot of flip-flopping. So first I'm going to start with the second left intercostal space, second right intercostal space, right sternal border, listening for your aortic valve. Good. Your second left intercostal space, left sternal border, listening for your pulmonic valve. Good. Your third left intercostal space, left sternal border, listening for your second pulmonic valve or your Erb's point. Good. Beautiful. Next, listening to your fourth left intercostal space, left sternal border, listening for your tricuspid valve. Good. And then I'm going to have you hold yourself up again. Perfect. This is your fifth left intercostal space, left sternal border, listening to your tricuspid valve. Perfect. Then finally, your last one, your fifth, intercostal space and midclavicular line, listening for your mitral valve, or you're at your apex. Good. You have a nice, strong, not abnormal, a very normal heart rate. And then I'm also just going to feel for, I'm going to listen to make sure that your carotid pulse is synchronized with your S1 and S4. It should precede. Your carotid pulse should follow S1 and precede S2, which is exactly what it sounds like. Awesome. Okay. Next, I'm going to have you roll over on your left side. Great job.
Oh, no.
Okay, so I'm going to have you kind of, lift your bra up like that, and I'm just feeling for your point of maximal impulse. It's right there. Sounds great. Next, I'm just going to do a special test, and I'm listening for any mitral murmurs. So I'm just going to give it a listen. Good, sounds great. Laying on your left side just accentuates if you were to have any mitral murmurs. Alrighty, you can go ahead and sit up for me at the end of the table if you'd like. Perfect. Alrighty, now we're going to do 2 more special tests. The first one, I'm going to have you lean forward, and I'm just going to listen down the same places on your left side that I did previously, and really second guess myself. And I'll have you lean forward, exhale completely, and then hold your breath. So let me know if you breathe, that's okay. But sounds great. Good. And that's to accentuate any aortic murmurs, and I didn't hear any, so that's good. Finally, the last one we're going to do is, do you know what bearing down is?
Yes.
Okay, perfect. It's also called the Valsalva maneuver. This will accentuate any hypertrophied cardiomyopathies. So I'm just going to have you, bear down, and I'm going to listen in those same exact spots. Last one. Good. Didn't hear anything either.
Noted. Okay, so thorax ratio is 1:2, AP to lateral. Breaths are even and unlabored. I'm gonna walk back here. All right, and I'm gonna put my hands right here. Take a deep breath. Thoracic expansion is even and symmetrical. Can you go ahead and give yourself a hug for me? Bend over just a little bit. Perfect. I'm checking your spinal alignment. Spine is erect. Perfect. Okay. I'm going to put my hand right here, and I'm going to have you tell me if you feel any tenderness. Nope. Nope. Okay. No. Nope. Okay. No costovertebral angle tenderness. So that's great. Now I'm going to have you say 99.
99, 99, 99.
Okay, no abnormalities with vocal frondus. That's great. So now I'm going to listen to your breath sounds. So when you feel my stethoscope, just take a deep breath. Perfect. Lift your arm up for me. Okay, other arm. Perfect. I'm I'm going to come around the front. Okay, breath sounds are even and unlabored. Okay, I'm going to feel your carotid pulses. Carotid pulses are even and strong. Now I'm going to listen to your heart sounds. Okay, got the aortic pulse, which is at the right second intercostal space. Got the pulmonic pulse, which is at the left second intercostal space. Erb's point, which is at the third left intercostal space. Tricuspid, which is at the fourth left intercostal space. And mitral, which is at the left fifth intercostal space. Okay, so now I'm going to have you lay down for me. Good. Abdomen is flat. I'm going to listen to your bowel sounds. And I'm starting in the right lower quadrant. Upper right quadrant. Upper left quadrant. And lower left quadrant. Okay, perfect. Now I'm just going to push on your stomach a little bit. Let me know if you feel any tenderness. In the lower right quadrant?
No.
Upper right quadrant?
No.
Upper left quadrant?
No.
Lower left quadrant?
No.
Okay. No tenderness upon palpation and no distension noted. No other abnormalities noted. When was your last bowel movement?
Yesterday.
Yesterday. Was there anything wrong with that? Everything good?
Yes.
Okay. Do you have any problems urinating, incontinence?
No.
Anything? Okay, great.
So every time my stethoscope touches your chest, you can just take a deep breath. Good. And now I'm going to listen to your heart. Aortic, right sternal border, second intercostal space. Pulmonic, left sternal border, second intercostal space. Erbs, third intercostal space. Tricuspid, fourth intercostal space. Mitral, fifth intercostal space, mid-clavicular line. I would also wait here for 60 seconds to listen for the apical pulse. Her heart sounds are normal with normal rhythm. And now I'm going to go back up and listen for murmurs. There's no presence of murmurs. Now I'm going to listen to your back of your lungs. And then you can just take a deep breath again for me every time my stethoscope touches you. Good. and then cross your arms for me. Her lung sounds are clear. Can you bend forward for me? Her spine is straight with no vertebrae sticking out. And then can you just tell me if you have any tenderness when I percuss? Good, so there's no tenderness when I assess the costovertebral angle. And then her AMP diameter is 1 to 2. Now I'm gonna assess your arms. The skin on her arms is intact and dry. She appears to be warm. Her skin color is normal for ethnicity. Her brachial pulses are equal and bilateral, +2 grade. Her radial pulses are equal and bilateral, +2 grade. And then can you grasp my fingers for me? Good, and then can you go like this? Her grasp strength is appropriate and there's no signs of clubbing in her arms or in her hands. There's cap refill in both fingers, and it comes back within less than 3 seconds. And then now I'm going to assess your abdomen. Lay down for me. There's no lesions or scars to be noted. The umbilicus is midline. The contour of her stomach is flat. Her stomach is symmetric. Right upper quadrant, liver and gallbladder. Left upper quadrant, stomach and spleen. Left lower quadrant, sigmoid colon and ovary. Right lower quadrant, ascending colon and appendix. There's bowel sounds in all 4 quadrants. And then I'm just going to percuss. There's dullness over the liver. All remaining quadrants have tympany. And then I'm just going to palpate your stomach, and then you can tell me if you have any pain or tenderness.
No pain, no tenderness.
Okay, good. And then